Hello, dear colleagues, and thank you very much for spending some time with me to discuss a very important scale, the Abnormal Involuntary Movement Scale, also known as the AIMS. My name is Rakesh Jain, and I am a clinical professor of psychiatry at Texas Tech University School of Medicine in Midland, Texas. Here is a brief outline of what we will be discussing. I will take you all the way from what is AIMS, why is it important, how do we conduct it, how long does it take to conduct it, what are the various components, how many items are in it, how do we score it, and we'll actually look at a patient to look at how an examination can be conducted. So let's go ahead and get started. First of all, what is AIMS and why is it important? Well, the Abnormal Involuntary Movement Scale, AIMS, is a rating scale that was designed in the 70s to measure involuntary movements known as tardive dyskinesia. TD is a disorder that sometimes develops as a side effect of long-term treatment with multiple medications, including neuroleptic medications. The AIMS test is used for two different purposes. One is to detect tardive dyskinesia, but also to follow the severity of a patient's TD over time. How often should we conduct it? The AIMS test is to be given every 3 to 6 months to monitor the patient for the development of tardive dyskinesia. For most patients, TD develops 3 months or later after the initiation of neuroleptic therapy. In elderly patients, however, TD can develop after as little as 1 month. Regarding the question, who can conduct the AIMS examination? The AIMS test was originally developed to be administered by trained clinicians. People who are not healthcare professionals, however, can also be taught to administer the test by completing a training seminar. How long does it take to complete the AIMS examination? Well, the entire test can be completed in about 10 minutes. You must be asking yourself, what are the components of the AIMS? Well, the AIMS has a total of 12 items rating involuntary movements of the various areas of the patient's body. These patients are rated on a 5-point scale of severity from 0 to 4. The scale is rated as 0, none, 1, minimal, 2, mild, 3, moderate, and 4, severe. The first 7 items refer to actual body movements. As you can see, the first 4 focus on facial and oral movements. The next 2 focus on extremities, and then finally the last item focuses on movements of the trunk. Items 8, 9, and 10 are for assessment of overall severity. The last 2 items, 11 and 12, refer to dental care. Let's now discuss the procedure to conduct the AIMS examination. Either before or after completing the examination procedure, observe the patient unobtrusively at rest, say for example, in the waiting room. The chair to be used in this examination should be a hard, firm one without arms. Have the person remove their shoes and socks. Ask about the current condition of the patient's teeth. Ask if he or she wears dentures. Ask whether teeth or dentures bother the patient now. Have the patient sit in the chair with hands on knees, legs slightly apart, and feet flat on the floor. Look at the entire body for movements while the patient is in this position. Ask the patient to sit with hands hanging unsupported, if male, between his legs, if female and wearing a dress, hanging over her knees. Observe hands and other body areas. The rater also looks at the patient in order to note any unusual movements firsthand. The patient is asked if he or she has noticed any unusual movements of the mouth, face, hands, or feet? If the patient says yes, the clinician then asks if the movements annoy the patient or interfere with daily activities. Ask the patient to open his or her mouth. Observe the tongue at rest within the mouth. Do this twice. Ask the patient to protrude his or her tongue. Observe abnormalities of tongue movement. Do this twice. The patient is then asked to tap his or her thumb with each finger very rapidly for 10 to 15 seconds. One hand followed by the other. Again, the rater observes the patient's face and legs for any abnormal movements. This is an activation technique. Ask the patient to stand up. Observe the patient in profile. Observe all body areas again, hips included. Ask the patient to extend both arms out in front, palms down. Observe trunk, legs, and mouth. This is also an activation technique. Have the patient walk a few paces, turn, and walk back to the chair. Observe hands and gait. Do this twice. This is an activation technique. Finally, after conducting this examination, you have enough information to fill out items 1 through 12 of the AIMS scale. Again, do remember, items 1 to 7 are face, extremity, and trunk movement assessment items. Items 8, 9, and 10 are for overall severity assessment. Items 11 and 12 focus on dental issues. After items 1 through 12 are correctly filled out, the AIMS examination is complete. Let's examine what a positive AIMS examination is and what findings on AIMS assessment raises concerns about the presence of tardive dyskinesia, also known as TD. A positive AIMS examination is a score of 2, mild, in 2 or more movements, or a score of 3, moderate, or 4, severe, in a single movement. The AIMS test is considered extremely reliable when it is given by experienced raters. It is an important component of a tardive dyskinesia assessment and monitoring. In conclusion, AIMS is a quick, easy to conduct, reliable examination for abnormal involuntary movements that can occur as a result of exposure to multiple types of medications, including typical and atypical antipsychotics. Regularly conducting high-quality AIMS examination is recommended for detection of tardive dyskinesia. Good clinical practice and practice guidelines strongly support the routine use of AIMS in appropriate situations. Thank you so very much for being with me as we reviewed the AIMS.